So I'm Lisa Lowry Crouch. I'm Head of Partnerships and Innovation. I'm going to be talking today about some of the engagement work that we've been doing over the last 2 years. So in the last 18 months, we've really noticed a huge increase in interest for engaging with communities to help improve service design and delivery, particularly amongst groups who we don't necessarily always hear from. But we do know it can be really difficult to engage with these people, and the implications that has is that their voices aren't heard and services are not representative of their needs. However, Involve is really well placed as a community organisation. We're established, we have really good links into the community, and we are trusted. So we've been working on a number of different engagement projects. The one I'm going to talk about today is around our maternity core connectors. So this is linked to a national programme which is delivered by NHS England, and the idea is to tackle health inequalities amongst 5 clinical areas in the most marginalised groups, so areas of high deprivation and other health groups. One of these specialities is maternity. So we know from data that Black women are 4 times more likely to die during pregnancy or after childbirth. Asian women are 2 times more likely. So there are huge inequalities present in maternity care. So we worked with Kent and Medway ICB on a Community Connectors programme to begin to address some of these inequalities. The programme had a sort of a 2-way function. So one part of that was to have our engagement officer and a team of volunteers in the community who would speak to women about the experiences that they had. The project was focused in DGS, so North Kent, where there are areas of high deprivation, also much more diverse groups, more women experiencing inequalities. So we went out and we spoke to over 350 women about the experiences that they'd had. Some were good, some were not good, and we do have some of that to show you this afternoon. And the other part of the programme was that we had people based out in the community who could provide information about maternity services. So we have volunteers that had information that talked about what antenatal care is available, what scans you should be attending, because there were many women, and still are, that don't know what's available to them, and if they miss that early care, it can lead to complications in pregnancy and in their childbirth.
My second pregnancy, 2019, right? I got far to 23 weeks of gestation. The second after visiting my midwife, I just started to have contraction and bleeding, so I had to reach to A&E, which they sent me to Tamuti. And there I was seen by the consultant, Dr. Rana, if I remember well, was her name. Yeah, she kind of explained me there's nothing that they can do, and just lose my baby. So with my son, was not the best, and I'm happy that I get the opportunity to talk about, because I think there's much to learn from this. I mean, the moms should always trust their gut, and even if they are wrong, just go and ask for an extra visit, I don't know, anything that you feel that it needs to be done for reassurance. And from medical staff, I think they just need to listen and to look at what the person in front of you is bringing up, and to think maybe this is important. Or if it's not, it's not, but at least you pay attention to details. And I think that would make a big, big difference.
I think in terms of the care, they should improve more on that in terms, because with my first, it was negligent. But then they should pay attention to individuals' help. And if we are pressing that emergency button, it was put in there because they know you will need it. They should make use of it. They should not assume maybe the way we react to pain is the reason why we're pressing that button.
They were very clean, they were very respectful. That's just one lady. She was the only one who was just, you know, not mistreat me per se, but she would, like, sometimes I would ring the buzzer and she would not be, she would just pretend not to hear. But apart from that, it was good. She told her, if you carry on like this, even her, luckily, I think one of the doctors is her boss or something. Told her, if you carry on, I've been hearing a lot of negative things. If you carry on like that, you're fired. And then the lady should have been more professional, whether she likes me or not, whether she does. She should have been more correct, because that's her job, because that's what the midwife does.
Mummies Link Up is just about, you know, it's a community group, and it's just for mums to come in to share their experience, get knowledge. We've got over 300 mums in our group, and we've got different mums we've got midwives, we've got GP, we've got different professionals. And then I guess what mum gets is, like, especially if you're a new mum, you don't really have anyone, if you don't have anyone to relate to, or sometimes even if you do, it's best for you to speak to other mums who have maybe gone through the same thing that you're going through, and they can give you advice.
So that's just a small snippet from the full video that we'll have. There'll be a bit more context around some of those individual cases, but I think you'll agree that it's much more moving and impactful to hear that directly from the person that said it, and I'd like to extend my thank you again to the ladies that did come forward and agree to be filmed. So we've taken the feedback that we collected in that part of the project and are working with the relevant services to hopefully improve things for women going forward. And that was actually the motivation for a lot of the people that we spoke to. They would say that they're happy to share because they don't want it to happen to somebody else, and that was really powerful. So we're positioning ourselves in a way that we can take on more engagement work and to do more work with communities that maybe aren't heard so much in things like service design and delivery or health research as well. It's offering a huge opportunity for us to become leaders in that area and to pave the way for other voluntary sector organisations to do the same. It also gives us an opportunity to share good practice in how to do this, and we've done some really good examples so far of engagement work in the community.